us a bit about yourself and this whole topic of self-care. But let's start with telling us a bit about yourself.
Um, I am a recovering perfectionist. I think I want to say that first. I'm a family physician specializing in functional and integrative medicine, and you're going to ask me what that is. I'm
Hmm.
going to tell you very quickly it's medicine of the past in the sense that we're going back to basics. It's what I call root cause medicine, where instead of treating a disease, you treat the patient who happened to get the disease, and we look for the cause. So it's called root cause medicine, it's called precision medicine, it's also called lifestyle medicine, because we look for why the individual has particular symptoms and we treat the imbalances to sort of get you back to optimal health.
Okay.
So it's science based, and I am doing that with a little bit of traditional Western medicine, some integrative, alternative, ancient medicine, and as well as the functional medicine. So I'm doing all of that. I'm an author. I keep
Yes.
getting that.
Yes, for sure. Keep and you do have a website, right?
Yes, TanyaBeaubrun.com.
Right.
So the reason I got into it and I was telling somebody is because when I was probably in my 30s with small kids, and so life was overwhelming. Life balancing work, life, and the expectations of what you thought people expected you to look like, to do with your life, to say. Um, and after a while, it became too much. And I have to admit that I came very close to burning out, and then I burnt out.
Right.
What I didn't know then was that I had burnt out.
Hmm.
Um, until I got really ill. So I was still wearing the hat of traditional Western medicine and looking for what disease I had. So we were doing tests and everything. And then I remember being in a hospital bed and I looked up at some of my colleagues and I thought, why are you looking at me like that? Um, and I just knew then that I had to take control of my health and my healing and consequently my life. And it was the start of me taking control, taking back who I was. And not just from a health perspective, from everything. It was taking back my power. And I went in search of all these things, not knowing then that I was totally imbalanced. I was perimenopausal. Um, my adrenals were fried. But this was not something that was spoken about in traditional Western medicine. So nobody knew.
Right.
And the doctors were traditional Western medicine doctors. And I was a woman in her 30s. So, of course, it's either hormones or stress, right?
Like
So,
these were
first
the
thing,
only two things it
oh,
could have
yeah,
been according to them.
of course, it's hormones or stress because the labs would be normal. So, what I want to tell you about functional medicine is that we look for out of ranges. But in traditional Western medicine, you look at your labs and people look for the red areas.
Hmm.
In functional medicine, we look for where it's out of what we call optimal range.
Okay.
Because in the optimal range is where we know that you function best. So my goal is for you to function optimally for as long as possible.
Hmm.
So what we will find is that you will have slight imbalances, things are slightly out of optimal range. We try to get you back into optimal range. This is when you start to really feel well, look well, and when you truly are well.
So let's talk about that side of you. In terms of self-care, how do you do it? You have three grown kids, you're
That's
married. Yeah.
grown.
Yeah, yeah. I was thinking of that. Yeah.
Grown.
Yeah, but if I
It
remember,
comes with its own set of responsibilities and issues. But what I find is that, so for instance, in my 30s, when all this was going on, I was working and I was organizing after school activities. And I remember I would leave work and go and pick two of them up and then drive up not across town to take them to swimming lessons and then drive back through traffic. And all the while I'm on this phone and I'm trying to phone in prescriptions and still manage. And then the only hat that didn't fit was mine. So I wore mom hat, I wore doctor hat, I wore wife hat, daughter, sister, friend. God knows what else, but
Yeah.
there was no Tanya hat that was on. There just was
Hmm.
no room for that. And that is the importance, and this is the message I want to take, especially now in the midst of this pandemic. It is critical that our self-care, and not just physical, but emotional and spiritual as well, that we pay attention to that.
Okay. So I want to ask you a question that for every young mom out there who's perhaps battling bottles, diapers, we remember those days, right? I always say to them, you know what, take your time because those of us who are doing this thing in this space perhaps have, have kids who are a little older, whatever, right? But what do you say to a mom who's now going through those growing pains and is really not having the me hat? Do you subscribe? Do you recommend that even then you find time for you? And where's that time?
That's the issue.
Mhm.
And I think urging at that stage, telling you you should practice self-care is ridiculous.
Yeah,
Uh, I don't even think you have time to even sit on the toilet for yourself when you're at that stage. It's true. You know that, and I'm being honest.
yeah.
Right?
Sometimes they come outside. They camp outside the door when you're in the bathroom, right?
Right? They come and they're knocking or they just open the door. Mom,
Oh my God.
So what I try to tell them is the most they can do is try to eat well.
Okay.
Because if you nourish yourselves with good, clean, wholesome food most of the time, you kind of stand a chance of at least feeling okay. So if you drink enough water and you eat properly, um, and I tell them, listen, you may not be able to exercise every day, but you could maybe a weekend you trade off with somebody and you get 30 minutes,
Yeah.
or maybe on your lunch hour. But then I don't like to tell them to, because it's when you can, you can.
Yeah. Oh, you know how they say to young moms, sleep when the kids are sleeping?
Ugh.
Like really? Like who wrote that anyway? That was
That's
never
when they put
possible
to
for
sleep.
me.
That's when you probably can get a shower when you have a load of laundry to put in.
Exactly.
It's just impossible.
Hmm.
My advice to them is to do the best you can
Yeah.
and reach out for help.
Okay. All
Right?
right. So we want to give people just a little teaser, not everything, because we do want people to just take time for you. This is for the girls out there.
Yeah.
So what can we expect in terms of self-care in particular? Can you give us just a few tips, Tanya, in terms of how do you do it or what do you recommend?
So
This is
I've
the
created my signature process is called the Body Joy Method. So I
Mhm.
keep saying process, but I was told by one of my coaches, it's not the process is what you go through, but my method is called the Body Joy Method.
Mhm.
And the goal of it is to help you live longer, healthier, and happier, no matter what your age. So what you're going to get on Saturday are the 6 pillars. So the 3 main pillars of the Body Joy Method is body joy, mind joy, and soul joy. Because I believe that the true healing will only take place when we get healthy physically, emotionally, and spiritually.
Mhm.
So I'm going to be talking about the whole pillars of these process, how to eat. Well, I'm not going to tell people how to eat because everybody has their unique, but I would give gentle suggestions, right?
Okay,
So
that's
it's
fine.
about nourishing your body, how to nourish your mind, and how to nourish your spirit. So I know it's not easy, but I think that if we commit to doing even 2 things for ourselves every day, so it could be instead of picking up the chocolate, we pick up a
Mhm.
piece of fruit.
Yeah.
Instead of taking the elevator or escalator, we walk up the stairs.
Mhm.
Um, Committing to drinking water, making, how do we get to sleep deeply? Because it's just a badge of honor. Oh, I only had 5 hours of sleep. Your cells are not going to repair properly if you only get
With
5 hours.
5 hours. Badge of honor. I have 6. Badge of honor. I
There,
get.
there you may be getting a little more repair with 6,
Thank
but
you.
seven or so. And I don't sleep 7 hours every night, I will tell you.
Yeah.
But if we know, and my thing is to educate,
Mm-hmm.
empower, as well as encourage, because you know what to do.
Mm-hmm.
Most people know.
Okay.
Um, Empowerment is a different issue where I tell you, listen, you can do this. But the encouragement part is a huge thing where we literally, I feel that My job is to partner with my patients on a journey to wellness. It's
Right.
not just leaving them. So you write a prescription, they go out and you never check on them, or you just, they have no access. The encouragement part and saying, listen, guys, I've been there. I've been 20 pounds overweight. I was 200 pounds on December 17th, 2000. That
Wow.
was when I was going to deliver my last child. And
Right. Right.
I went into hospital for cesarean and I stepped on the scale. I looked down and I bust out laughing. And the nurse looked at me, she says, why? She goes, that's the last time I'm going to see this because I'm making no more babies. And she said, so what are you going to do or something? And I said, well, what's for dinner? And when they told me, I'm like, no, I'm not having that. So
Wait, this is just before having your baby.
this is the night before, babe. The cesarean is due in the morning. I'm like, I'm not eating that. It's my last meal with abandon. So I chat, but they wouldn't allow me to leave. So I had to discharge myself.
Mm-hmm.
I went out to a restaurant. I had the biggest meal I could eat that I wanted. And I went back and I checked myself back in. And then it says, you figure that if you're really, really good now.
Right.
What do you want now? But I've just had great meal. I was not having that hospital meal. My last meal, hell no, not doing it. So when I went back to recheck me and to readmit me, I'm like, I'm not stepping on that scale now. That's the
No,
weight you got there. That's the weight you're putting on.
nobody needs to know.
Nobody needs to know how many pounds I've just eaten. I'm like,
Right.
no. I said, I did this 2 hours ago. I am not stepping back on the scale. I am not thinking. But the point is that you go through stages in life.
Thank you for sharing with us today, Tanya. I appreciate that.
I'm really looking forward to sharing on that.
Yeah. The self-care is just so important. Without, I find like a lot of women feel guilty almost, so we don't want to go into that now, but I imagine you'd be sharing those strategies with us. And I'm pretty much very excited and interested in hearing about, that body joy method. That's wonderful. And if anybody's hearing, my kids are home today. That,
That's
yeah.
life. Love
You know
this.
what? That's life. I mean, COVID has taught us to kind of relax in who you are, where you are, and I so appreciate that. So
So
thank
the
you.
perfectly imperfect parts of life are the best.
Absolutely, that's what it is, and it's okay to be that way. Really.